Hey there. Today I'm diving into a pretty heavy topic. Should doctors refuse treatment to smokers post-heart surgery? This ethical dilemma can stir up a lot of debate, especially among us medical professionals. So let's break it down. Imagine this. A patient undergoes a heart bypass surgery, a major life-saving procedure. But instead of turning over a new leaf, they continue to smoke. Now you're faced with a difficult decision. Should you refuse further treatment? First off, it's crucial to remember our primary duty as healthcare providers, to do no harm. Refusing treatment seems counterintuitive to this principle. After all, every patient deserves care, regardless of their lifestyle choices. However, there's more to it. Let's consider compliance. A patient who continues to smoke post-surgery isn't following medical advice, which could lead to complications or failure of the procedure. This non-compliance can strain resources and potentially harm other patients who might need urgent care. So, is it fair to prioritize a non-compliant patient over someone who adheres to medical guidelines? Ethically, we have to weigh the balance of beneficence, doing good, and justice, being fair. Some might argue that refusing further treatment could serve as a tough love approach, pushing the patient to quit smoking. But this can backfire, potentially causing more harm than good by depriving them of necessary care. Let's not forget the concept of autonomy. Patients have the right to make their own choices, even if they're not in their best interest. Our role is to provide the best possible information and support for them to make informed decisions. Another factor to consider is the societal perspective. Healthcare resources are limited, and there's a constant need to allocate them efficiently. By continuing to smoke, the patient indirectly contributes to increased healthcare costs and resource utilization. But is this a strong enough reason to refuse treatment? Ultimately, this ethical dilemma doesn't have a one-size-fits-all answer. It requires a nuanced approach, considering each patient's unique circumstances. Engaging in a compassionate, honest conversation with the patient about the consequences of their choices is essential. It's about finding a balance between our ethical duties and practical realities. What are your thoughts? How would you handle this scenario? Share your insights in the comments below. Until next time, stay informed and keep making a difference.